done and I still have my drain. It was 5 days after the surgery. I felt like I'm moving around good. I'm doing okay. My friend is here. My friend flew from Texas to take care of me, right? And to run my household because I'm a single mom and I have kids and dogs and a whole household. And so I don't have anyone here that can really take care of me. Everyone, my friends here work and they have these like 9 to 5 type jobs, and she works remotely. So she was like, I can come, I can work from your office and I can take care of you like I did when you
Right.
had your hysterectomy. She's like, I love it. She's amazing. She's like a great nurse. She cooks, she does like everything. And she took really good care of me. And I was like, I want to go take her out. Like, I want to go have some fun. And after my hysterectomy, we went on a little excursion out and I was very careful and everything like that. I did have like some more bleeding, but it was nothing too bad. And we had actually one nice day out after that surgery. So I thought, I'm going to do it again. I couldn't do
Mm-mm.
it. I was like,
No.
I can't do it. I need to go. Like, this was a mistake. I should not be out of my
Yeah.
house. People were looking at me crazy because when you have, you get your stomach sewn down, they pull the skin down and then they sew it. It's very tight. So when you're talking about tight, I totally get it. It's so tight. It's so tight. It's painfully tight.
Yes.
You cannot walk upright. You're walking like out your whole life for weeks. You're in a V position. So most girls get a recliner, which I'll talk about that stuff like, or you have to prop yourself on pillows in a certain way because you cannot stand up. So you're hunched for days and days and days. A lot of girls get like a little walker. I did not have one. We'll talk about that later. And then your back starts to kill you. And so you're like hunched and everything you're doing, you're hunched over. So I'm outside. I've got a bulging drain out of the front of my dress. I'm like enormous. And I'm like hunched over and people are looking at me like, what is wrong with her? So like, it's like, I'm like, and plus I couldn't handle it. Like there was too much walking. It was too soon. Right. So
Yeah.
that day, I'm like, okay, well, we couldn't go out and have dinner out or do anything fun. So I'm going to order a really nice dinner in. And the dinner was great, but it made me swell. Like because of the sodium or whatever was in it, it added to my swelling. So I
You
was
had you had you
completely
had you
miserable.
had you had meat.
I had fish. I had fish.
Mm.
But I don't know, I had maybe something how they cooked it, how they prepared it. Whatever happened, I swelled even more. And by the next day, I thought it felt like my body was going to burst. Like I was so swollen. And then in my stomach, the incision is so tight and then the swelling, like my body felt like it started to pucker and then it felt like someone was like if you had a piano wire and like you see in the mob movies and they're like choking someone with a piano wire and the wire's cutting in. It felt like that. It felt like it was cutting into my body, like I was going to cut in half. It was so painful. And I was running low on my pain meds by then too, and the doctor's office was closed. And it was just like I was trying to manage it. So it was difficult. I had a very difficult recovery. So definitely I feel you when you're like, oh, I made this choice and it wasn't the best choice for my recovery. And it was a lesson for me because I was like, okay, now I'm eating clean, healthy, pure, perfect. And I'm not going to do anything that I
Right.
feel like would jeopardize my recovery any further. And that's kind of how it happened. But I want to go back to something you were saying, right? You were
Hmm.
talking about the steps that you went through in Colombia. And you
Hmm.
said that after the surgery, you had to have microneedling done. Why
Yes.
did they do that?
She said that it will help more to tighten more the face because she put a machine under my skin when she did the surgery. She put a machine under my skin and she said I was gonna feel that between 3 and 4 months, and it's true because right now I'm in the 4 month and I still sometimes feel pain in my neck, like very tight, and here under some here is very tender, like tender around here too, behind my ear still tender. So after that, the microneedle, that she said that is better for your skin and everything. I couldn't handle, but I don't know. She's a doctor. She said that machine does wonderful, and she find out that it's better to do a microneedling after the surgery. I think was the 10 day, because I was too tender in the 7 day. It was, yeah, the 10 day I went there and I said, no, this is too painful.
Wow, I can't imagine getting microneedled
And I
right
bet
after my
in their face,
surgery.
yes,
Oh my gosh,
it was
that's
too much.
crazy. I'd be like, "Put me to sleep." Like, I
That's what
don't
I said
wanna
to
be
her.
awake. I don't wanna be awake for that.
That's what I said to her. You have a doctor, you have two doctors here. They have the anesthesia doctor. Why they don't put you like for 15 minutes and boom, 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 15 minutes, you wake up at 20 minutes after.
Or they can give you like a medicine that I remember before my hysterectomy, they gave me something, I can't remember what it is called. It's on the tip of my tongue. Oh, I can't think of what it's called. But she said, "Do you want this?" Because I was so nervous before the surgery, right? I'm always so terrified before I have a surgery. And so she's like, "Do you want this? It will make you not remember. You won't even remember going into the operating room. You won't feel be aware of anything that's happening to you, basically. And
Right.
so at least you won't be aware that you're in pain, right? But you're awake, but you won't be aware of it, right? I think that would be something that they would
It should
do.
be. It should be. But yeah, it was painful. And then, and my recovery, yes, like you said before, in my case, I have to sit down, sleep almost like this, with a
Mhm.
lot of pillows around and sleep like this. I couldn't sleep like this. I couldn't sleep like that. Now I'm sleeping like this, but I have to put something here so my neck don't do this.
Wow, I feel that like you cannot I have to get used to sleeping sitting up because I did not have a recliner. Okay, first of all, let me tell you how I made this decision. I always knew I would do something like this, but
Right.
I was going to do it awake. I was going to do like a laser lipo or something like that before I realized my abs were the real issue. There was a deeper issue than just like, "Oh, I just want a flat stomach. Let me just fix it." No, there was
Right.
like a medical thing happening. So,
Uh-huh.
I talked to all of these different surgeons. I talked to one in California, I talked to one in Texas, and I talked to two of them here where I am, and by Portland. And so, what ended up happening was the guy in Dallas was like, "What you need, you should be put to sleep for," because I was going to do it awake. And they were like, he was like, "No, it's not a
Mm-mm.
good idea."
No
Um,
way.
One surgeon from California rejected me all completely. They were like, "We can't help you. We're sorry. We can't help you." But they didn't say anything else. And I was like, "That's weird. I can't even give my money away." And to them, I'm like, "Okay." And it made me concerned. I'm like, "Oh my gosh."
And what
And then
was
I
the
talked to
reason?
and well, I found out when I talked to the guy in Dallas. So the surgeon in Dallas was like, "For what you need, you should be put to sleep." He's like, "It will come out better for you and you'll have like a better recovery and everything. And I don't think that you should do an awake procedure." And
Mm-mm.
he's like, because you need more than just skin removal, skin tightening,
Right.
you have, it looks like you have a problem with your abs. And I was like, "What?" Because it was virtual. So he couldn't like really touch me or anything like that. So I went to the second doctor here, Dr. Zach Barnes. It was great. And at this place called Athenix here in Portland. And he took a look at me and he was like, "Wow, you have such a beautiful shape." He's like, "This is going to be fun." And like he was excited. And he taught the procedure and he's been doing it forever. And I felt really comfortable. Obviously, he's board certified. And I thought, I liked his energy, I liked his vibe. And he was like, kind of, he goes, "Let me see." And he's like feeling me and he's like, "Oh, we need to do an abdominal repair." And I was like, "Oh," and he was like, "Yeah, we're gonna fix you up. You have a big space," and he explained it all out to me, and then I realized, "Oh, that's why the other place can help me," because they were like sort of like a place that just focuses on, um, awake procedures, fat transfers. They do like fat transfer, breast enlargement, like
Right.
they do like BBLs, and they do like they will do your stomach, but it's like very minimums. Like if your stomach's just a little poochy, they can do it, right? And so when I went back and I looked at their pictures, I was like, yeah, there's no one who looks like me in their befores on their Instagram.
Right.
So they didn't have the capacity to do what I needed done,
Right.
which is fine. I went to where I was supposed to go, and he did a very beautiful job. I will show you. You'll see all of it. Let me tell you, honey, next summer, you're not going to catch me in a full length top. Maybe even next winter too, because right now I have to wear a compression garment. I wear a faja,
Yeah.
and so, but I'm snatched. Like he did a good job. Like whatever vision he saw when he was like, "Oh yeah, this is going to be fun," he like really made that happen. So I'm really pleased with it, but the recovery was very mentally and emotionally tumultuous for me up until probably Monday of this week. Like
Mm.
I was just really I had a lot of doubts. I had a lot of almost like regret in a way where I was like,
Really?
did I do the right thing? Like
Hmm.
I mean in my clothes, I don't look that much different because I was always able to really hide it, right? But naked, it's a whole world of difference, right? Of course, I do have a big scar. It goes hip to hip,
Hmm.
but he made it very thin, and I think it will heal well. I'm a little bit concerned about the corners on my hips, but they tell me because it looks a little puckered, but they tell me that as the swelling goes down, it'll flatten out and it should be fine. But fingers crossed that that's true, or I might have to have a revision. Because you can get something called dog ears where it like
Hmm.
pokes out, you get like a kind of a hump
Hmm.
on one or both sides, and it throws your figure off. And I don't want that, right? Because there was nothing else about my body really that I didn't like, right? There was a little bit of fat on my back that they took off too, just because I wanted it. But by like my bra roll. But so other than that, everything like my thick thighs, I'm really super happy with them. I don't mind. Thick thighs save lives, honey.
Right.
Um, but this stomach situation was, I felt like it was the one thing holding me back in my pinup too, like from really, really having, I mean, I've always managed to hide it. And you don't see it in the pictures, but inside, it's like an inside job, right? It's your mind and your heart, you're feeling not as sexy as you
Right.
want to feel, and you deserve to feel sexy, beautiful, and amazing. You should think that, like for yourself. Like if no one else thinks that you're sexy, beautiful, amazing, or hot as a guy, because guys get tummy tucks too, by the way, and they get work done, right? Um, if you're not feeling hot, sexy, and amazing to yourself, that's the biggest issue. I don't much care what other people think.